Today I'm here with Sara, a respiratory therapist who also suffers from chronic cough, and Dr. Imran Satia, an internationally renowned expert in the field of chronic cough. Among his many accomplishments, he's currently an assistant professor at McMaster University and was a co-author on the most recent ERS chronic cough guidelines. He has been an invited speaker at national and international medical conferences and has authored numerous publications on the mechanisms and treatment of cough. Dr. Satia is here with us today to debunk some of the most common myths regarding chronic cough and perhaps change our perspective on the way we see this chronic disease. Also, we'll discuss what specifically is needed in Canada in this day and age to help those with chronic cough.
So thank you everybody for joining us today. Dr. Satia, we have a few questions for you if you're hopefully willing to answer them for us.
I'll try.
Okay, the first one is, pardon me, in your opinion, what are some of the most common myths around or regarding the chronic cough?
Okay, that's a very difficult question because there's potentially so many things I could say. But let me have a stab at this by saying, I suppose the first thing, Sarah, that I've found generally within patients, but also a lot within physicians in primary care and secondary care and my colleagues, is that chronic coughing is a minor issue which you just have to learn to live with. It doesn't really cause any significant problem in your life, and you've just got to carry on living with this. And the reason I say that is because by the time patients come to see me, they've often seen 3 or 4 other physicians, and they've probably waited 5 to 8 years to come and see me in a cough clinic. However, what I see and what I hear from patients, that it isn't a minor ailment, that it has had a significant impact on people's relationships, on their jobs, had impact on their work life, their employment, their income, and people have terrible physical symptoms such as chest pains, abdominal pains, and urinary incontinence, particularly in women, which is a terrible consequence to have. So in my mind, this is a common myth, which I don't think it's true, that it's a minor ailment. My second, I suppose, related to this issue is that there's a myth that chronic cough, it's just a symptom of another disease. And if you find that other disease and treat it, everything will get better. And often, therefore, chronic cough is not seen as a distinct disease entity in and of itself. It's seen as something which is secondary to a lot of other things. And most commonly, those are considered to be things like asthma, reflux disease, and upper airway nasal symptoms, postnasal drip. These are the common 3 things that people often attribute to chronic cough. But I would ask or rebut my colleagues and my friends who say this by saying, if you go to a reflux clinic and sit in the waiting room, and people who've got terrible heartburn or indigestion, these patients are not coughing hundreds or thousands of times a day. If you ask pregnant women who suffer from terrible heartburn, particularly in the first and second and third trimester, as they're progressing, they can get terrible incapacitating heartburn, but they don't get cough. They don't have chronic cough. If you go to a moderate to severe asthma clinic and sit in the waiting room, they have my other symptoms of wheeze and breathlessness. And some of them do have chronic cough, but they're not coughing the hundreds and thousands of times a day that often patients with chronic cough are. So in my view, there's something else going on top of those diseases. Those diseases, they may be, I view them as triggers or associations, but not the direct cause of causing coughing. And I think that there's another bridge between those diseases and the chronic cough, which is causing that. And I would call that this idea of that this is a cough hypersensitivity syndrome, where the nervous system, which is responsible for making people cough, has become too sensitive and too responsive. And that could be in the periphery between the lungs, the throat, and the brain, or it could be related to the brain itself being more sensitive. So I think that's another second common myth, that chronic cough is not a disease in and of itself. And now there's so much more data and research that I've been involved in, which is clearly now showing that chronic cough is a distinct condition. And the third thing relating to this, I suppose, is that people with chronic cough, we can't do anything for these patients. That once you've tried inhalers, puffers, and nasal sprays, that's it. You've come to the end of the road and nothing else can be done for you. And I think that's another myth, because we've now, over the last 20, 30, 40 years, there's so many more medications out there that people have trialed to control the coughing. And even non-medicinal options. There's people who do speech therapy, which in some patients, not everybody, in some patients, that has a significant improvement in their coughing. In many other patients, they require low doses of morphine sulfate or pregabalin or gabapentin or these types of medications which are designed to reduce the cough hypersensitivity component. And the other promising thing is that now we have novel new clinical trial data of a medication which blocks the P2X3 receptor. And the one that is most recently been talked about is something called gefapixant, which has clearly shown that inhibiting this receptor has a dramatic improvement in cough frequency. And we're hoping that over the next coming years, we're going to have a whole new class of treatment for this condition. So I think those are the three myths which I think I'll stop at. And I hope that's been of some interest to the listeners.
Those are all great myths. And as you know, with me being a patient as well as an RT with the chronic cough, those are definite myths we see in society. And hopefully, yes, we're going to clear them, right?
Hopefully, yes, absolutely.
Yeah. So another question we had for you was, a lot of patients with chronic cough will say they're using cough syrups. What is your opinion about the use of cough syrups for the treatment of it?
So from an academic perspective, I do know that a number of groups have done meta-analyses and Cochrane reviews on this subject, and they have found that generally speaking, overall, over-the-counter cough syrups don't have any significant improvement in cough frequency more than placebo. That's the bottom line. Most of these cough syrups have a combination of medications such as dextromethorphan, which nobody really knows how it works, but again, it's a centrally acting medication. Some of them have the addition of codeine in it, small amounts of codeine if you look at it. So there'll be dextromethorphan, maybe codeine, some don't. Other medications people add in is something called guaifenesin or menthol even. So these are all things that people add in to try and reduce coughing. But from a clinical trial and research perspective, none of them have ever shown any benefit. Some people, however, say that the syrup itself has a demulcent effect on the throat. That it might not be the actual medication that's helpful in some people. Some people find that the syrup, it soothes their throat. And that's also why I think one of the reasons why people suck sweets is that when you're sucking the sweets, whatever it is, it's actually having a demulcent soothing effect, and the swallowing is actually inhibiting the coughing. Because one of the things I mentioned is that it's impossible to cough and swallow at the same time. So if you're continuously forcing yourself to swallow, then what you're actually doing is you're inhibiting the coughing by actually swallowing. So these are my own view is that some people might find that cough syrups might be helpful. I would just be careful about using too much cough syrups because some of these can be addictive and some of them obviously have low doses of opioids in it as well. So just be careful about using these over-the-counter cough syrups.
Okay, that's a good answer. There's a lot of misunderstandings and confusion as well when it talks about causes of chronic coughs. Is there a true known cause? Or as you've sort of said earlier, there's probably a variety of triggers, but do we have an actual cause? Yeah.
So that's a very good, I've kind of briefly talked about it before, but the way I view people who cough a lot is that the bottom line, which I think is going on, is that we know that cough is a nervous or neuronal reflex, which is activated in the peripheral nervous system, and your brain then processes that and makes a decision to say whether or not to cough or not. Generally, cough is seen as a defensive mechanism. We cough to try and protect the lungs and protect bad things going into the lungs. They could be chemical things, could be mechanical things like foreign body and objects and peanuts. We would all cough if we were to send a peanut down the wrong way. That's normal. That's supposed to happen. But somehow, for some reason, people with chronic cough, that system has become too sensitive. And you have these other conditions like asthma, reflux disease, nasal disease, laryngeal sensitivity, which are kind of, I see as things which trigger and may sensitize that system, and are therefore have made that system more sensitive. And sometimes treating those triggers is important. And sometimes we do see that somebody has asthma, we treat the asthma, cough gets better. That does happen. And that's why it is important to investigate the potential underlying triggers and associations. So that's still very important in the diagnostic algorithm, that you've got to go looking for, like a detective, what could be something underlying that might be triggering and sensitizing that cough reflex. And the other important thing is that, as I mentioned, the fact that now we have specific blockers for coughing, which is working, that also corroborates this idea that there is something very specifically going wrong with ATP in the lungs or in the upper airways. So that again is taking us towards that chronic cough is a distinct disease.
Yeah, so it can be mixed in with the asthma and everything else, but it can also be its own entity.
Yeah, exactly. Yeah. But some people don't have anything. You investigate and there's completely unexplained. There's nothing that I can find.
Yeah. Just chronic cough.
Yeah.
Okay.
Yeah.
Perfect. Okay. Bearing in mind that there are so many myths and misunderstandings, what can be done to educate the public and prevent misunderstandings or preconceptions, misinformation, that sort of thing?
So I think education and awareness has to form the bedrock of any type of getting rid of or demystifying or debunking such myths. And I think we all need to do our bit, physicians, healthcare providers, and patients themselves. We have different tools now available. We have podcasts like these. I spend a lot of my time talking to patients and talking to other healthcare providers. But it's very important that we disseminate the knowledge that we currently have about chronic cough to as many people as possible, so that they understand what acute cough is, what subacute cough, what chronic cough is, what investigations to do as in the primary care, what investigations should be done in secondary care, what investigations might be offered in tertiary care, and what are your treatment options. I fully appreciate and understand that journey can be a long one. It can take, in some cases, many years, but I think 5 years is too long. I think somebody who has chronic cough more than 8 weeks, within a year, I think that's something which is achievable to try and improve and get to the bottom of somebody's cough within a year of seeing somebody. And I think that's a good target to have. So education for sure is very important. I suppose the other thing is in our within Canada specifically, one of the things that I've been trying to work on is to try and create a better network of cough experts who can learn from each other. We have a good network of people in Ontario, but we're trying to develop links with people in Calgary, Alberta, Edmonton, and the East Coast and the West Coast. And I hope that by creating a network of cough specialists, that we can help each other and spread the word and improve the care of patients suffering with chronic cough in our individual localities, in cities and urban and rural areas. So we really need to do a lot of work around creating a better network of cough specialists. And I'm hoping that over time, patients themselves will be able to form some kind of a group themselves, which we can, as clinicians and healthcare providers, work with. And together, we can start asking some deep questions about why have people suddenly developed this chronic cough in the first place? Somebody's been fine for 40 years or 50 years. And then suddenly we understand that there's been this problem with this cough hypersensitivity. But what I can't tell you is why has that happened in the first place? and there's a lot of work that needs to be done around the switch that has happened, and can we actually recognize that, predict that, and stop that happening. So there's a lot of research that needs to happen, but in order to do these big research projects, we need a momentum of experts who are really willing to invest and champion this cause. So I'm hoping those things will certainly help as well.
Perfect. And like I said, you've got me on board. I'll definitely help you. So this one, the next question I have for you is pretty near and dear to my heart, because with the current COVID-19 pandemic, there is a large stigma that has developed around chronic cough. You cough, it's like you've got the plague. You know, I know a lot of my friends know me, they know my cough, and they'll actually stop people and go, it's okay, she doesn't have COVID. So what's your advice for those who struggle with it on a daily basis, like myself?
So I think this is a very tough question, because there's no right or wrong answer, and nobody really knows exactly what to do. But part of this, the answer to this lies in the education piece and the awareness piece, is that not every cough is COVID.
Right.
So that's the first thing. I think from a public perspective, the public need that awareness to understand that there are, there's a considerable number of people in Canada. It could be as high as 10 to 14% of the general public have chronic cough. That's a lot of people. And I think that people need to understand that not every cough is an infection. That's the first point. From your perspective, from a patient perspective, I think it's difficult, because what we do know is that people with chronic cough, they find it more difficult to voluntarily suppress their coughing. So we know from research that compared to healthy people who can just think about not wanting to cough and actually make it happen and not cough, whereas people with chronic cough, they can't do that.
No.
And so often people, will say, oh, just stop coughing. That's actually not very helpful.
No, not at all.
So that kind of advice is not helpful. So I would tell your friends to not say that to you, because it's actually phenomenally difficult for chronic cough just to voluntarily suppress their coughing. I don't know whether or not you find in your opinion, in your practice, things like swallowing, sucking sweets, drinking, and even wearing a mask. Some people actually find the mask problematic. They find it very claustrophobic and humid and dry. So they often don't like wearing the mask, which is a bit of a concern. But thankfully now we don't have the mask mandate in public. We don't have to wear that. In healthcare settings and long-term care, we still have to wear the mask to protect our vulnerable people. But generally speaking, not everybody's masking. If you can mask, great. If you can't, then you don't want to make your cough worse. If you do cough, try to cover your mouth by putting your hand above your mouth to make sure that the aerosol is not flying around everywhere, and that might reassure your friends and colleagues around you. So trying to cover your mouth is very important, and that's general advice. But yeah, I think those are probably my tips. Is that I feel sorry for patients who have chronic cough and the stigma that's associated with it in these times. Again, this causes significant anxiety for people to go out. I have patients who are just scared to go shopping because they say, what if I start coughing? Because some people, as you know, they have a coughing fit, and once they start, they can't stop. And so they're scared about going in public, and if that happens, how are they going to deal with it? So this is a major issue, which we need some more support for, I think, for certain.
It's absolutely true. It's a genuine concern. Going out for a meal is another big one, I find, because if you're always afraid you're going to go into a coughing fit, as you say, for sure. Yeah. Well, I want to thank you so much, Dr. Satia, for doing this for us today. It's definitely one of those ones that we have to continue to research, support, get communicated, because it's a really important topic that we got to keep going with. So thank you very much for joining us today.
My pleasure. Thank you very much, Sarah, for having me, and for Respiplus for organizing this. It's been great.
Thank you.
That's it for today. Thank you for listening. We hope you enjoyed it and were able to get a few insights from our speakers. Make sure to subscribe to our channel so you don't miss the upcoming episodes. We'll be publishing a new podcast the first week of every month, so stay tuned. You can also follow us on various social media platforms. Just look for Expand Courses by Respiplus.